welcome. If you've just tuned in, you're watching Focus On with myself, Keamogetswe Mosepele, and today we are at the Africa Health Exhibition and Indaba, hosted at Gallagher Estate in Johannesburg. Today we are profiling Africa's biggest health conference and some of its key sponsors, asking the question as to how health outcomes influence the economy and development of a country. Stay tuned. I have just been joined by Professor Robert Bragg. He is from the Department of Microbiology and Biochemistry at the University of the Free State. Mr. Robert Bragg, thank you so much for joining us.
It's a great pleasure.
And why did you decide to make it here? And what are your key takeaways from the event so far?
From the event, well, I'm joining Africa Health primarily in conjunction with PMB Health and Services. Because I've been assisting them in some of their product development, and the takeaway from this is it's an amazing event. It's everybody's coming together, people from all over Africa are coming together, so it's a really good event.
Speaking to your expertise and as well as your work with PMB Health and Services, can you just chat to us from the people not involved in the medical industry? What is a superbug and how do these superbugs become resistant to disinfectants?
Okay, so superbug, the term superbug normally refers to bacteria that are resistant to antibiotics. So if you think antibiotics are natural products that other organisms produce when they're competing for nutrients. So the bacteria that we're using the antibiotics against have had millions of years of evolution to develop resistance mechanisms. So the antibiotic resistance is very well known. What's much less well known is the development of resistance to disinfectants. So disinfectants is what you're going to use for cleaning surfaces. Now, with the growing problem of antibiotic resistance, so if a person contracts a bacterial disease, and the antibiotics no longer work, there are no treatment options left. So what we have to focus on is making sure that the environment is kept clean, so stop the people from getting infected. And disinfectants play a key role in that. So what's less well known is bacteria also develop resistance to disinfectants. And what's a little bit scary is the mechanisms for antibiotic resistance and disinfectant resistance are similar. So you can develop antibiotic resistance without even using antibiotics. So it really is a significant problem, and the resistance to disinfectants is becoming more and more an issue.
So can you just share how does this resistance come about, and also emphasize why is this such a problem?
The resistance comes about, if you're talking about antibiotic resistance, it's man basically has misused antibiotics since we discovered them. So the unnecessary prescription of antibiotics, and that has created antibiotic resistance. But if we think COVID, everybody was using disinfectants. I mean, you went into a supermarket, you had some arbitrary stuff sprayed on your hands, you didn't know what it was. There was massive amount of disinfectants that were used during COVID, and the number of bacteria that are now resistant to disinfectants has skyrocketed because of the massive use of unregulated, untested, unregistered disinfectants. So that's caused the major problem.
Now you've highlighted that some of these cases happen in a hospital environment. What can be done for those who are seeking care and are already in a immune-compromised situation, but as well as those healthcare workers that are responsible to help them get better?
The concept of biosecurity is what becomes then very important. You need to stop the healthcare workers as well as the patients coming into contact with the pathogens. So in other words, you have to clean the environment. You have to make sure that the environment where the people are working and coming into is free of these pathogens. Unfortunately, if a person has contracted a multiple antibiotic resistant bacteria, there are basically no treatment options. And what's really scary is it's been estimated that in the not too distant future, the people dying from antimicrobial resistance will be more than the people dying from cancer. So it's a really, really scary problem. If the person has contracted the disease and there's no antibiotics, the person basically dies.
Thank you, Robert.
Great pleasure.
Continuing our conversation on biosecurity, I am joined by the CEO of PMB Health and Services, Mr. Bruce Manuel. So what are the ways in which PMB goes about creating biosecurity?
Well, thanks for the opportunity. We are a proudly South African company bringing locally manufactured biosecurity solutions to the African continent, and we are now looking to the rest of the globe. So we have three products, by and large, that we are showcasing at Africa Health this year. One has been in the market for quite a while, which is an antimicrobial and sporicidal disposable bedside curtain. So the curtain that goes around the patient. So that plays a role in minimizing the spread of hospital-acquired infections. And we're quite proud of the fact that all the material is sourced in South Africa. We are now, contributing to the greater GDP of our country as a result, and ready to export the product. So two products that we are launching at Africa Health. Also, we're very proud of these products. Are all South African manufactured. We have listened to our customers over the last few months, specifically around the curtain, as I've mentioned. There were issues around blood spillage and splatter on the curtains. So we're launching a new product that can alleviate that problem, remove the blood from the curtain. But importantly, speaking to your question on biosecurity, that product can also be used to clean the surfaces in hospital environments to kill pathogens that are in the environment of a hospital. The other product is a fogger can. It's a unique product, and it's creating a lot of buzz at Africa Health. So we're quite excited about that. That product can be used in an ambulance because your emergency service teams are frontline staff. So we need to ensure their safety is uppermost, and it can also be used in a hospital environment. So as the name of the company suggests, it's health and safety. So we've designed our products to ensure that the safety of staff is uppermost, because if they can function in safer environments, they'll ultimately deliver a better service to the patient. And the patient obviously sits at the center of all of this. The patient safety is even more uppermost in mind.
And I also want to talk about your role here today. What has been your experience at the Africa Health exhibition? And more importantly, what would you like to happen, and what are your hopes for today?
Well, it's been absolutely fantastic. It's been our first time participating. We are sponsored by the Department of Trade, Industry and Competition. So we're quite pleased to be a part of that process. And it's very pleasing for us as a local company to have a big brother, so to speak, behind us. And again, it talks to that whole point of the GDP and contributing to our economy positively. And the show has also allowed us to interact with current customers, prospective customers, not just from South Africa, but from around the globe. I mean, we've got interest out of Canada and from other parts of Africa. So, for us, this is a very important place to be, given that we are launching, new products. And we're also then, talking to our customers to understand, what are the other challenges from a biosecurity perspective.
I understand you are at the helm of PMB Health and Safety, and you are a company that is quite sustainable or interested in green conscious movements. Can you just provide us insights into the healthcare sector impact on energy use on the continent?
That's a very, very important question. So our curtain, for example, it plays a massive role in minimizing the carbon footprint for hospitals. So our curtain can remain hanging in a hospital environment for up to 24 months. So you can just imagine the impact that has on the carbon footprint, because there's no need to wash the curtain in that period, right? So logistics plays a massive role when it comes to doing laundry in a hospital. So we are contributing in some form through that product. And also that product, we are now in the phase of looking at the recycling of it. And but we need to be mindful of the science behind that, and also keeping in mind that because the curtain kills bugs, we know we need to be mindful and understand the science a bit better once the recycling process has come to an end.
And I am going to take advantage of having you here, and I'm going to ask you a topical question that's quite popular on the news cycle. We understand that South Africa's healthcare system is under transition, and they are proposing a model of universal healthcare, namely the National Health Bill. What are your opinions on this?
Yeah, look, I've been tracking that in the media for obvious reasons, but I think it's needed. By and large, our products are used in the public health space. There is interest in the private sector, but for us, you know, the market size of the public sector is slightly bigger. But I'm an advocate for it, and you know, as I said, we're working in that public health sector space. We can see the system is stressed. We can see how people need healthcare. So I'm an advocate for it.
Thank you so much. That was Bruce Manuel. He is the CEO of PMB Health and Safety. And that's how we wrap up today's session of the Africa Health Exhibition right here at Gallagher Estate in Johannesburg. Join us tomorrow for more content on Africa's biggest health conference and some of the innovations taking charge across the African continent. From myself, Keamogetswe, Mosepele, it's goodbye for now.